Hello, everyone. I am Michelle Melville Cashan from Sexual Health Alliance. I am the Community Development Coordinator, and we are preparing for our special event, Keeping the Spark Alive, happening in August of 2024. And I'm so excited to introduce one of our presenters that we have. Dr. Uzma Rehman is an associate professor in the Department of Psychology at the University of Waterloo. Her research lies at the intersection of intimate relationships and sexuality. So, her talk title for the event that we're having is titled The Role of Shame in Sexual Communication, a conceptual overview and practical implications. All right, so welcome. We're so happy to have you.
Thank you so much, Michelle. I'm really excited about joining all of you, meeting the attendees, even though it's virtual, and presenting some of these ideas.
Yes, thank you. And so, could you tell us a little bit more about what you're going to be talking about at this event?
Yeah, so shame is such a interesting therapeutic concept and such an important one because now there's a lot of research now also I think clinical intuition tells us this as well is that shame plays a really important role in a variety range of mental health outcomes that are relevant to sexuality, and it also plays a role in how, when, where people tend to discuss sexual issues. And so sexual communication is such a critical part of the therapeutic process, whether it is with talking to your therapist about what you are or are not disclosing to partners, or what you are disclosing directly to the clinician that you're working with, and what you're not disclosing. So, understanding the role of shame and really having a solid conceptualization of it, I believe, is incredibly important for clinicians.
Yes, definitely. So does your work focus more on like shame and communication between a person and their provider or a person and their partner or all of it?
Yeah, actually, my work mostly focuses between partners, but we believe that some of similar processes also play a role with the provider and the individual as well. So there are aspects of shame that people carry with them, and they show up in different contexts in their lives, right? And sexuality, unfortunately, is one of those parts of our core identity that culture, family, other influences, sometimes religion, that these factors can really, these different influences can tell us that it is hide aspects of your sexuality. And so the it really can link the link between shame and sexuality can be very strong. I mean, I think the strength varies from individual to individual. And I think that's one of the things I want to talk about is like, how do you know when it's a very strong connection for the person you're working with? And what does the research tell us will happen when there is a very strong connection between the two? And how can you be an informed clinician in terms of being able to address it thoughtfully?
Yes,
Mhm.
I think that is going to be so helpful. And I think, culturally, I'm from the USA, and I think there's so much shame around sexuality, and people just don't talk about it, and
Right.
I think we've seen some progress over the last couple of years, and it's slowly getting a little better. But
Yeah.
overall, people don't want to talk about sex. People are embarrassed, even people communicating with their partners, they don't want to talk to their partner about it, and I think that makes things more challenging.
Absolutely. I think that, and I mean, if you look even though there's progress, you can kind of see all the forces that also work toward trying to bring it back into the area of shame, right? Bring sexuality back into a more shameful space or shameful ideas. And so like you kind of see both of these forces playing out culturally as we live and breathe. So
Definitely. So, what is one tip for somebody watching this video and maybe they feel a lot of shame around talking about sex or their own sexuality? Like, what is one tip? Like, where could they get started and working through that shame?
Yeah, such a great question. And I think, like, I was thinking about this, and there's a couple of seeds I want to plant in people's minds around this. So one seed I want to plant is this idea of shame as a as an emotion that hides. And I would like people to reflect on that statement in relation to themselves. Like, is it an emotion? Like, how do I know it hides? And what tells me that I am in more of a protective hiding place for myself, and when has that come up in relation to shame? And the second concept is shame is a shapeshifter. So when what does it mean, this idea of shame being a shapeshifter, and does that resonate for people at any level, or how might they even think about that? So we'll be discussing these ideas more in my talk.
Oh, I can't wait to hear more about that. Shame is a shapeshifter. I love it. That is so fascinating. I can't
Yeah.
wait to hear more. So, if anybody else is watching this and you also can't wait to hear more, please join us for our online weekend. So, you can join from anywhere in the world, which is really amazing. It's going to be in August. We're going to have the link below so you can get tickets. It's held on a Saturday and Sunday. And we hope you can make it. You can learn more at sexualhealthalliance.com. Any final thoughts before we go?
No, I'm really looking forward to it. Thank you so much, Michelle.
Yes, thank you for joining us today. Thanks for watching, everyone. Bye.
Bye.